Hi, in this video, I'm going to be talking about chemotherapy-induced cognitive changes, or chemobrain. What is it? What causes it? How does it show up in your life? And what can you do about it? Before I go on, I'd love to have you subscribe to our channel. We're putting out new content all the time. So let's just call it chemobrain. What is chemobrain? Chemobrain is a colloquial term that refers to cognitive changes from chemotherapy. The types of problems that we see are problems with memory, concentration, and information processing. As many as 75% of people can get some form of chemotherapy-induced cognitive problems, or chemobrain. It doesn't last forever. Not everybody gets it. Some people get it and don't actually notice it. And people who don't get chemotherapy don't get chemobrain. So it's really restricted just to chemotherapy, not even targeted therapy. Any type of chemotherapy can do it, and I'll talk more about the chemotherapy types and schedules where we see it more often, as well as who else might be at risk. What people notice with chemobrain is that they have a harder time finding words, recalling conversations, remembering where they put things, or multitasking. People who are used to being high processors of information, so they can manage multiple things at once. They don't have to take notes. They don't have to write things down. They do the crossword puzzle in ink, are actually more likely to notice chemotherapy-induced cognitive changes than the rest of us. So if you're somebody who works in a fast-paced office with lots of demands, you may actually notice this before and more profoundly than other people, though most people who have these problems that we can find on testing will have some symptoms themselves. So how does chemotherapy affect the brain? Well, chemotherapy affects rapidly dividing cells. And while most of our neurons are formed before we're even born, or develop by the time we're about 2 and mature fully in our mid-20s, there are some parts of the nervous system where cells are turning over more rapidly. These happen to be the cells that help us lay down new memory, pay attention, and process information coming at us from all different parts of our world. Chemotherapy can affect those cells. It can also affect neural pathways. So neurons communicate one with another, and there are pathways formed in our central nervous system. And chemotherapy can affect those neural pathways. So associations we have between one thing and another can be affected, and that can make it harder for us to process information or remember where we saw somebody, for example. Where did I see her before? Whether it's on a television show or out and about in the real world. And then finally, chemotherapy can affect the synapses. Those are the spaces between nerves where we have neurotransmitters. And chemotherapy can affect the synapses that help those nerve cells communicate one with another. It's also the case that chemotherapy can lead to a state of inflammation, and that oxidative stress, that inflammatory stress, may affect the way our brains work. Now, for most people, these changes are not permanent, and I'll talk a moment about the timing when these changes show up and when they get better, as well as ways to help yourself if you are noticing these problems. The other thing I want to say is there are other things that happen with chemotherapy that can affect our ability to think clearly. So one of them is we give medications that will help prevent side effects. One of the most common medications we give is corticosteroids. This is the dexamethasone, the brand name for which is Decadron, or you might have heard of prednisone. These medications are really important to prevent sometimes allergic reactions to medications, or nausea, which can be absolutely terrible and be even worse sometimes than vomiting. Corticosteroids are an important part of your treatment plan. They're not chemotherapy, but they help manage or prevent the side effects of chemotherapy. And they can cause problems with attention and with sleep. Sleep problems can occur for all sorts of other reasons, like anxiety or having a lot on your mind, or being on the corticosteroids, which can actually make you feel a little bit agitated. And we know sleep disturbances and anxiety and mood problems like depression can all make it hard for us to remember things, pay attention, multitask, or process information. There are other medications you may be on, like pain medications, that can affect your cognition as well. So it's not just the chemotherapy. And if you're already noticing problems with cognition before you even start chemotherapy, it's likely to be some of these other things that we give before chemotherapy and just the major change in your routine that can happen with a new diagnosis of cancer or any serious illness. The other thing that's important to recognize is that chemotherapy can cause changes in hormonal levels. So in particular, chemotherapy can affect the ovaries, which make estrogen as well as other endocrine substances, other hormones. And those fluctuations can cause some problems with sleep and nights, sweats, night flashes. Even if you don't wake up, your sleep can be disturbed by hormonal changes. So that's another thing that goes into all of this cognitive problems we see with chemotherapy. So who's at risk? Well, we can't actually predict who's going to have cognitive problems from chemotherapy. Only about 5% of people will have long-term cognitive problems. So in people where chemotherapy has minimal benefit, the concern about cognitive problems comes up. In people where the benefit of chemotherapy is much greater, where we can cut the risk of recurrence by half and double your chances of living a long life without cancer, we will tell you about cognitive problems and will help manage them. But that doesn't tend to sway our decisions or recommendations about chemotherapy as much from a medical standpoint. It may matter to you, so it's really important that your medical team know that this is going into your decision making about whether or not chemotherapy is going to be part of your treatment plan. Other things that might increase the risk are if you already have some cognitive problems, whether it's from mini strokes or whether it's from having cerebrovascular disease, or factors that increase your risk of cerebrovascular disease like diabetes or heart disease, you may be at higher risk. But I have to say, in my years of practice, I could never look at somebody's list of current problems and predict who would or would not get problems from chemotherapy in terms of their cognition. Some people on long-term medications for mental illness or other side effects of other conditions, if you are on, for example, a medication to help treat neuropathy from diabetes or other causes, you may notice that chemotherapy-induced cognitive changes look a lot like the cognitive changes of those medications, and the two together can be really difficult. Although I mentioned that some people with existing cognitive problems may have more cognitive changes from chemotherapy, it's also the case that people who are really sharp may notice them more. So it's really only through formal testing before starting chemotherapy and after that we can actually attribute cognitive problems specifically to chemotherapy. And with all the other things that people are on, we tend not to do formal cognitive testing unless we're going to embark upon cognitive rehabilitation, which I'll talk about more in just a moment. So we've talked about the risk factors, why it happens, what it looks like, how frequent it is. What are some of the things that you can do if you're noticing you're having problems with cognition? Before I go into that, I just want to talk a little bit about the timing. If you're having cognitive problems during chemotherapy itself, while it certainly can be chemotherapy related, it's just as likely to be related to anxiety, sleep problems, hormonal changes, hot flashes that interrupt your sleep without you even knowing it, and other medications like corticosteroids or other medicines we have you on to treat the side effects. It can certainly be from the chemotherapy itself, but most people that I've treated with cognitive problems after chemotherapy do say that it's after chemotherapy or towards the end as you're getting through most of your cycles of chemotherapy. In some people, we see some problems that weren't present, maybe even weeks or months after the end of chemotherapy. But for most people, the onset is towards the end of chemotherapy or soon thereafter. So if you're 2 years out from chemotherapy and you're having cognitive problems, it's unlikely to be related to chemotherapy, and you should be evaluated for other causes of cognitive problems. So what do you do if you're having cognitive problems that have been attributed to receiving chemotherapy? I'm going to start with some of the basics. The basics include working on your sleep. We have another video on managing sleep. Make sure you talk with your medical team if you're having sleep problems. There is a lot we can do for sleep problems. You may even be seen by a sleep specialist, but you want to attend to the basics. So sleep is one of those. Sleep to me is as important as food and water and movement. Speaking of food, make sure that you're eating regular meals. You may find that you get cranky, or you may have heard hangry, which is that anger that comes about when we're hungry. So make sure that you're getting small, frequent meals if you're finding that you're having problems with cognition or thinking, memory, attention. You can't multitask like you used to. Just make sure you're taking care of the fundamentals. And then another I mentioned is movement. We know that exercise and movement of any sort is anti-inflammatory. And if cognitive problems from chemotherapy are related to inflammation, it makes sense that doing things that can decrease inflammation might be able to help. There's been some research done on this, and there's more work being done to see if exercise can counteract the effects of chemotherapy on our thinking, attention, memory, and information processing. I do want to say that there are no supplements that have been shown to improve cognition. No matter what is advertised during primetime TV, there are no supplements that improve cognition. That doesn't mean we're not looking. That doesn't mean we're not trying to find things that can help. But in general, a balanced diet that's very colorful, meaning lots of fruits and vegetables and leafy greens, will have the types of things that you would want to think a supplement might have. But supplements, we don't even know if they have what they're said to have. And most of them have not been tested for purity, and they've not been shown in trials to be safer or more effective than getting food the way nature intended it. I know this is something we've talked about before. We have a video on supplements during chemotherapy I'd encourage you to watch. And I know you may have your pet supplement. Really, the only thing we can't get through our diet is vitamin D. If you have a lot of leafy fish or vitamin D fortified foods, you might be able to. And you may not need supplements, but if you're having a hard time getting in enough vitamin D in your diet, vitamin D supplements might be a good idea to talk about with your medical team. So we've talked about sleep, we've talked about small, frequent meals with lots of leafy greens and colorful foods. We've talked about movement. Believe it or not, socialization can actually keep us much sharper being around other people, even if it's frustrating because you're dropping words, you can't remember words. Staying away from people because you feel bad about your ability to hold a conversation may actually make you make your cognition even worse. We need natural stimulation from other people. Doesn't have to be in person. You can meet all sorts of people on internet chats and other people who have similar interests, playing games with people. We know that crossword puzzles and Sudoku unfortunately do not protect us from Alzheimer's, but they can certainly help you pay more attention. In another video, I've talked about learning another language. There actually is data that learning another language or refreshing a language you used to study can help your cognition, can help you with word finding in your own language. So there are lots of apps out there. You can actually practice a language with people on the internet. If you have a tip for how you've learned a language, share that with the Yerbba community. It is really helpful to help with word finding. Another thing that we have encouraged you to do in other videos is to stay organized. So if you find you're missing appointments, take advantage of technology, whether it's a piece of paper and a pen, which I guess used to be technology in the really old days when papyrus was invented, or use an app on your phone. You can arrange to set an alarm on your phone if you want to make sure you allow enough time to get to an appointment. You can have a buddy who helps you if it's something really important you don't want to miss. I happen to be a pencil and paper person myself, but I do use alarms to remember appointments and other important things I do. Find what works for you, and you can ask for help from your friends. I'm sure people would be happy to give you free advice on what's worked for them, and you don't have to spend a lot of money. A lot of apps will cost money, but you can find ones that are at absolutely no cost to you if you have a smartphone. Other things that can help are to avoid what we call multitasking, which is really just scattered attention. So let's say you've been a star multitasker. That's great. If you can switch your attention from one thing to another, to another, to another. We actually have gotten to the place where we can barely pay attention now to a conversation we're having or an email we're writing without getting distracted. Multitasking doesn't actually work. We think we're doing more than one thing at once. We're actually not. We have a video on people with ADHD and going through breast cancer treatment. If you find that your attention's really scattered, even if you don't have a diagnosis of ADHD, you might find that video helpful, as well as some of the comments that people put underneath. But in general, focus on doing one thing at a time. We call that mindfulness, just paying attention to the conversation you're having, the email you're sending, the book you're reading. You may need to train yourself to increase your attention span. You may need to set a timer and say, I'm going to read for 5 minutes, and then increase the time. You can train your brain again to have more attention. These are the types of things that, whether somebody has problems related to chemo or not, you will find when you start asking people, they'll say, I have that problem too, which can help you feel less alone. The last thing I want to talk about is cognitive rehabilitation. There are people who specialize within the rehabilitation specialty at helping people who've had all sorts of problems with their brain, whether it's a brain injury or a stroke, or have had chemotherapy. You can relearn, you can get some more formal training in the form of cognitive rehabilitation, where you get sort of a prescription for doing exercises to improve your cognition. You will need a referral for this, so talk with your medical team about cognitive rehabilitation and see if that might be right for you. This will be preceded by cognitive testing. Your rehabilitation specialist will want to know specifically what to focus on and what level of impairment you have compared to other people your age. I've covered a lot in this video. I hope it's been helpful. If you have a tip or trick, please share it with the Yerbba community by dropping a comment below. We can also answer general questions, although we can't give specific medical advice, of course. We can answer general questions that might be helpful to you. Don't forget to subscribe to the channel, and thanks again for watching.